North Dakota legislators met April 28th to discuss the nation's new healthcare law. It appears legislators will need more information before they can figure out how the new law will play out in North Dakota. The committee chair also acknowledged that he will allow a wider range of viewpoints in the next meeting. Today's meeting brought out 5 out-of-state speakers. The leadoff speaker was Michael Tanner of the Cato Institute. Cato is an ideological think tank that supports dismantling Social Security and Medicare, opposes farm payments, and opposes medical licenses for medical providers. Mr. Tanner opened the meeting using highly polarized language from the Washington, D.C. battle over healthcare reform.
The healthcare bill is, if you add both the original bill and the reconciliation bill, a little over 2,500 pages long, about 400,000 words. Or as I like to think about $1.2 million per word. According to the Congressional Budget Office, if this bill had not passed, health insurance premiums would have roughly doubled in the next 6 to 10 years. According to the Congressional Budget Office, as a result of this bill passing, health insurance premiums will roughly double over the next 6 to 10 years.
Much of what Mr. Tanner said was skewed by his opposition to healthcare reform. The committee chair, Representative George Kaiser, did not invite someone from a more moderate or progressive think tank to provide balance. Throughout the day, legislators asked the panelists questions.
The CMS reports that the cuts in Medicare spending out in the plan will lead to 15% closure of hospitals. But we're already there in North Dakota with our Medicare reimbursement rates. And so where's the balance point in this bill, given the Frontier States Amendment?
Yeah, you do get, there were some increases in reimbursement rates here, which would be helpful.
Have you determined what the loss of facilities would be if there was no bill?
No, I haven't, and I will suggest $600 million is going to have at least a substantial short-term impact.
A lot of us are asking those questions. What's the process going to be in terms of time frames rather than philosophical, observations and assessments of what we think about things? It's the law right now.
This thing has only been law for a month. The philosophical debate, in large part, is over. This thing passed. It is the law, and we need to figure out how to best incorporate it in North Dakota. Because of this requirement for the health insurance exchanges, and that it has to be certified by January 1st of 2013, we're already running out of time.
Legislators heard from the National Association of Insurance Commissioners, the National Council of State Legislatures, and Pharmaceutical Research and Manufacturers of America. Some of their information contradicted what Mr. Tanner of the Cato Institute had said earlier. At one point, Chairman Kaiser tried to get Melissa Bianchi of Pharma to say that the new law would mean higher prices for drugs, but she resisted that.
Am I wrong in assuming that the cost of drugs for everyone else will go up if you're going to have to subsidize the donut hole, or you have so much wealth that you're going to do it out of the goodness of your heart?
Well, I guess I'm not sure either of those would be quite as to the cost of drugs, I can't speak for all of the individual companies as to what they will do with it.
The drug companies are going to pay 50% of this cost.
Right.
Do you anticipate that the cost of drugs will go up to offset this increased operating cost?
I don't know.
And in all those cases, will that mean that the cost of pharmaceuticals will remain constant or go up?
I mean, I can sort of make the guess in the same way that you can. I mean, I think it's possible that they'll go up, but I don't think whether they'll go up any faster than sort of the rate of inflation or that they do already.
Spokespeople from 4 state agencies also came with information. Much of it was preliminary and more calculations are needed. The legislature brought in Dr. Wayne Taylor of McMaster University in Hamilton, Ontario, Canada. He's a critic of the Canadian healthcare system and is partially funded by the pharmaceutical industry. Also speaking was Dr. William Canham, originally from Canada but now in Bismarck. He is also critical of the Canadian system.
So this is pure politics, and I understand that, having been in the political arena many years ago.
I've always had an interest in medical politics. So I pretty well divided my time between two somewhat different healthcare systems. This is by far the most popular government program in Canada. And And that's notwithstanding the fact that both sides demonize the other.
In 2007, it took Health Canada 487 days on average to approve a new drug as being safe and effective, as compared to 277 days here with the FDA.
One place where it's criticized, thought to be a weakness, is it's slow to implement technology and cutting-edge treatments. I think that's not a weakness. I think that's a good thing. Certainly there hasn't been a problem with public administration, comprehensiveness, universality, portability. And the problem, as you can appreciate, and your chairman wants me to talk about this, was with the last pillar, and that's accessibility.
Chairman Kaiser did not invite anyone with the more positive perspective that most Canadians have of their healthcare system. At least one potential presenter, a leader in rural healthcare in Canada, was suggested in February. There were some North Dakotans in the audience who had their own experiences with the Canadian healthcare system.
I came here to show my support for the healthcare program. And then you hear a lot of people talking against Canadian health insurance or Canadian health program. I had first-hand experience with that one time traveling in Canada. My daughter had emergency appendicitis surgery in Canada, and I thought I'd probably have to write home for money, and I talked to the doctor, and he said, "Don't worry about it, I'll send you a bill." And for the 4 days in the surgery, my total bill was only $250. And so that's when I started following healthcare programs. And now today we had this Canadian doctor, apparently an extreme conservative, talking and running down this country's program and on how terrible it is. I kind of wondered why is he staying in Canada if it's that bad. I've talked to Canadians every chance I get while traveling and stuff, different provinces, different programs, and I haven't found any of them that are against or don't like their healthcare program. And so I think our No Party, which is receives or temporary or part-time legislature receives free health care, yet they seem to be continuing to try and stop the citizens of the state from receiving low-cost or reasonable cost insurance. So that's why I'm kind of continuing to support this health care system. Thank you.
Republican legislators kept trying to nudge panelists into making sound bites that would back up the Republican agenda.
My question is this. If the Frontier Amendment had not been in the health reform bill at all, would you have still supported the health reform bill?
We know healthcare has to change. And given where we stand on the cost, quality, performance, what we have been advocating is to incent and reward quality of care and realign payment systems around that. Reward our good work here in North Dakota.
If you could maybe answer a yes or a no, would you have supported the health reform bill if the Frontier Amendment had not been in it?
That's a choice we never have to make.
Chair, we were told this morning that this bill is going to double healthcare costs in the next 6 to 10 years, and no one nationally refuted that. So I guess my question is, as you look at this bill and the provisions in this $1 trillion bill, is there anything that tells you that we're going to hold healthcare flat in North Dakota?
Mr. Chairman.
Senator Pine.
In reference to Representative Burke's question, the point was given, it was from Tanner, the Cato Institute, Mr. Tanner, who said that healthcare costs will double under this bill. They will double without this bill. That's what he said in the next 6 to 10 years. He said it was a wash.
North Dakota organizations which have worked on this issue for decades were in the audience.
Clearly there has been a lot of important information shared here today, and clearly there's a lot that we don't know yet about what the overall impact of healthcare reform legislation will be in the states. I think it is a little disappointing that more of the emphasis has not been on the positive aspects of the legislation and the fact that there are benefits in this bill that are going to be huge, provide huge benefits to many North Dakotans and many Americans. And to remember yet further than that, the very bottom line, that this is about people's health and keeping our citizenry, all of our citizens, healthy. So I appreciate every opportunity to learn something more, but I also think that we have to give thought to a broader spectrum of information and make sure that we are considering all the variables before coming to negative conclusions.
The legislature, state agencies, and North Dakotans will continue to learn about and discuss how the new law will affect North Dakota. So stay tuned.